Picture a family in a city like Karachi. It's 2 in the morning. Their father is in the emergency room. The doctor asks, what medications is he on? What's his baseline blood pressure? Is there any history of kidney disease? To answer these questions, the family is frantically scrolling a WhatsApp gallery where lie blurry photos of lab reports, a prescription from a clinic they no longer visit, and a scan from over 3 years ago. The doctor has nothing, so he starts from zero. This is not a rare story. This is the daily reality for over 5 billion people. Healthcare doesn't fail because doctors or hospitals are missing. It fails in the spaces between them. Every time a patient switches clinics, their medical history resets. Duplicate tests, missing baseline, prescription errors, preventable harm. The files don't travel with the patient. The entire burden of continuity has been quietly shifted onto families, onto the people who are already sick. ShifaOne solves this with one action billions of people already do every day: taking a photo. Point your camera at any medical document, a blood report, a handwritten prescription, a radiology scan. Our AI extracts the clinical data instantly, turning unstructured paper into structured, searchable metrics: hemoglobin, blood pressure, HbA1c. Every scan adds to a single chronological health timeline, owned by the patient, not by any hospital. A patient's HbA1c tracked across 18 months, blood pressure trends visible at a glance, and clinical notes parsed for specific details a doctor actually needs. One account holds profiles for the whole family: an aging grandfather, a mother with a chronic condition, or a child recovering from illness. No manual entry, no hospital dependency, no special hardware. Just take a photo. The market is 5 billion people across South Asia, the Gulf, Africa, and Southeast Asia. Every one of them is facing the same continuity failure. We start in Pakistan to validate and scale fast, then expand immediately to Bangladesh, the Gulf states, and Africa, markets where ShifaOne doesn't compete with existing infrastructure, it becomes the infrastructure. The model is multi-sided. Customers pay $15 a year against a $7 acquisition cost, a 53% gross margin. That consumer base unlocks institutional revenue. Hospitals, insurers, and government programs pay $10 per user annually to access verified longitudinal data they can't generate themselves. Year 1, we have 100,000 users generating $1.5 million in revenue. Year 3, 2 million users, $30 million in annual recurring revenue. The consumer is the entry point, while the institution is the scale engine. This is not a concept. We have completed over 350 beneficiary interviews and launched active pilot cohorts, stress testing our AI with real paper records. Right now, we are implementing ShifaOne inside a large tertiary care hospital and a multi-clinic network in Karachi. Live deployments, real patients, real continuity gaps being closed today. What pilots taught us? Simplicity wins every time. Just take a photo outperformed every complex workflow we tested. Zero training, adopted by users of every age. Because this problem is real, and our solution is working. We are raising our seed round to scale to 2 million users across 3 regions. But what we are really building is something that should have existed a long time ago. No family should walk into an emergency room and reconstruct a lifetime of medical history from memory. No doctor should make life or death decisions without context. No patient should lose their health story because they changed hospitals. The value in the next decade of global healthcare is found in the layer connecting fragmented providers, isolated records, and disconnected episodes of care. ShifaOne is that layer.